In this video, I'm going to talk to you about 4 of the most common causes of one of the most poorly understood, poorly recognized, and poorly managed causes of an unsettled and highly irritable baby. Guys, it's Dr. Scott. I'm here. My little fella is down having a nap. He's as settled and as happy as a pig in mud. He has a full belly. He has a clean nappy. But I'm going to talk to you today about 4 of the most common causes or common instigators or signs that your baby has what's known as shoulder dystocia. Now, I'm going to be honest. Shoulder dystocia is some fancy words that basically means I have a really sodding sore shoulder. Without doubt, one of the most common contributors to this is the birth process. As the baby's coming out, their head comes out and then their shoulder gets caught on mum's pubic bone. Very commonly, this shoulder injury occurs and it's very poorly assessed, most commonly overlooked by the majority of health professionals that deal with babies. So today, 4 of the most common signs that maybe your unsettled baby is suffering with shoulder dystocia. Number 1, and it's quite an easy one, is simply getting dressed and undressed. The action of putting arms through a shirt, through a onesie, through a singlet, whatever it may be, is a surefire sign, particularly if there's an asymmetry. In other words, if one arm goes through the shirt really comfortably, but the other arm, the kid always gets cranky when that arm goes through, that's a really strong sign that that shoulder is quite uncomfortable for the little one. Flowing on from that would be typically these kids also don't particularly enjoy bath time. So simply the whole association with getting dressed and undressed and then the movement of arms. One of the other signs of this will be they have a real side of preference when it comes to feeding, especially if mum is breastfeeding using the more traditional nursing hold. What kiddo can't do is get their shoulder comfortable when they're in that position. So quite often you'll notice these kids will prefer to feed with their sore shoulder side up as opposed to downwards. One of the other indicators, and it's particularly associated with irritability and a sign that they're unsettled, which means affecting their sleep, is very commonly these kids will not enjoy being swaddled because they find that position very uncomfortable. Quite often you notice these kids will like to have one arm out and about moving. Having said that, very commonly their sore shoulder side will be a lot less mobile than the other one. So when you're moving on in age, so you're getting your child up to about 3 months, when they're starting to spend more time on their tummy, starting to develop more ability to push themselves up through their shoulders, you will see an asymmetry. So shoulder dystocia, it is ridiculously common. It is very poorly understood and managed by the majority of health professionals. However, it is a significant contributor to a very unsettled child. So if your child or anyone you know seems to be behaving like that, flick them this video, hook them up with a comment below, or tell them, look, get in touch with us. We can assess and correct that reasonably quickly and easily. Otherwise, I hope you're all well. It is now in March. The year is flying by, and I'm sure I will see each and every single one of you real soon. Bye.